The Ministry of Health is expressing frustrations with the doctors' union officials over the dragging of the pay demands talks.
Forever, for the union makes us strong.
KMPDU officials are said to have stormed out of the talks with the ministry Tuesday afternoon after rejecting an offer they are alleged to have accepted earlier on the day.
And I had a simple question. What needs to be done to the union to convince their members to resume work? One, they told me that the allowances which they were given in Mombasa were acceptable and must be retained from 1st January 2017. Secondly, they requested that the government considers, because we had elevated the entry point of the doctor intern to job group M, the rest of the doctors be promoted one job group higher. And then the other issues, the general issues of the CBA which we had agreed, remain.
Health Cabinet Secretary Cleopa Mailu said he had met with the officials and agreed to the new proposals which they had promised to share with their members.
We conceded to those demands. They didn't even read it because we were expecting to go through it. They walked away after that, irrespective of meeting their needs, the request which they had made.
Mailu says he was hopeful for a breakthrough after 8 weeks of back and forth, only to be disappointed by the change of tune by the officials.
Yeah, we pleaded with them. In fact, they said they will come on Friday. And then the document, we had gone through it up to page 10 that time. And therefore, all those issues we had discussed with them. And we would have expected in normal negotiations, there's nothing wrong with somebody saying, we are going to look at this document and come back. Contrary to what we were expecting, that we can engage, and hopefully by tomorrow we bring this matter to an end. Now, when a union agrees on a position and changes the following minute, it becomes very difficult to negotiate and to reach an agreement.
Under the new improved package, in comparison to the doctor's demands stipulated in the 2013 CBA, a doctor in the lowest job group M was to receive house allowance of 28,000 shillings as opposed to 30,000 shillings, doctor's allowance of 66,000 shillings, a hike from 30,000 shillings on the CBA, commuter allowance of 6,000 opposed to 20,000 shillings, risk allowance of 10,000 shillings opposed to 60,000 on the CBA, and extraneous allowance of 30,000 shillings from 60,000 shillings demanded by the doctors. But the doctors are accusing the cabinet secretary of trying to ambush them with a new offer which does not contain their input. The officials say they will submit themselves to jail after the talks seem to have hit a dead end.
You cannot perpetrate injustice in the name of dignifying the court. There is no amount of dignity that comes to the court when you jail doctors who are speaking for the aspiration of Kenyans. We say that you want to jail us. That's injustice. And we shall proudly walk into jail. When you wake up tomorrow and on Thursday and we have walked into jail, doctors will still be on strike. And you, the Kenyan, what kind of a healthcare system shall you have?
Addressing over 500 medics gathered in Nairobi, the union officials say they have explored all available avenues in vain.
If your society is dishonest, they know that there are a group of honest people called doctors. They are the clean ones. The system will make us look like the villains, but we are the victims. They will call us sewage because we've said the truth. But at the end of the day, we shall triumph. We shall overcome. Because this journey belongs to doctors to change health system.
Juni Karisa for Channel 1 News Hour.